and welcome everyone. I think some people's mic. Okay. Am I very audible?
Yes, Mama.
Okay. John Kelvin, you are the first person that came in.
Thank you.
Thanks for being punctual. So
Thank
again, is here. You have Chisom, Pascaline, Omamuzo, and Doyin Awofeso, Zobia, Musin. Okay, maybe if you are from Nigeria, just tell us where you are joining us from. If you are joining from outside the country, tell us your own country. Just put it on the chat. You may need to mute your mic, so just put it on the chat. Let's know where you are joining us from. I can see Chiamaka, Ibeji, David, and some other people. I saw my chief, Dr. Me. I can't see her again. So she entered.
My chief. I'm your student. Well done.
Oh my, no, a chief remains a chief.
I'm a
Chief
student.
remains a chief. You're welcome, ma.
Thank you.
You're
Thank
welcome.
you.
Okay.
Yeah.
All right. Okay. Shruti, we can see you from Canada. Kelvin from Nigeria. So you can just put it on the chat where you're joining us from. You need to have an idea of who we have in the house. We'll soon start. I don't usually like wasting time. So that's because we have a lot to do. Okay. So Preeti from India, you're welcome. I see Zubia. Zubia, where are you joining us from? Chisom and let's know where you are joining us from. Okay, so we'll just give 1 minute, then we'll start. The others, they will catch up with us. Okay, Chiamaka from Nigeria, you're welcome. Chisom from Nigeria, you're welcome. Some people raise their hands. Any problem? Zubia, and if you have any issue, you can speak up if there's any issue. Or we put it on the chat. Okay. So you're all welcome to today's medical writing coaching program. You know, it was just like this. So just like it was last year that we had it. And before I knew it, another 20th September came up again. And this was a promise that I made when we started. That even as at that time, I wasn't so sure of what I was actually doing. But then I made that promise that we'll have to do this yearly. And I thank God that we're here. So you're welcome once again. We'll soon start. I'm about sharing my screen. Isma, but you're welcome. Okay, if you can see my screen, give me thumbs up. Thumbs up if you can see the screen. If you can see the screen, thumbs up. I need to be sure that we're together. All right. Okay. Okay. So we're together. Okay, so you are all welcome to today's free medical writing coaching program under the auspices of BS Medical Consulting and Communication Services. And today is September 20th. And the next time this will happen will be September 20th of 2026. Whichever day, whether Monday or Sunday, whenever we find ourselves, and it's September 20th, 2026, we'll do this again. And it's a yearly thing that we have to continue from now on. So the story is a bit long. I will try to abridge it, sort of. Okay. So I decided, instead of just doing free medical writing coaching, just coaching like that, I decided to narrow it down a bit, because we have our own challenges. Those of us from the global south, I believe we understand what global south means. By the time you remove US, Canada, UK, China, almost all the other low and middle income countries were termed as the global south. Not really that it has anything to do with the south. It just denotes places where you have low resource settings, and we have our own challenges even when it comes to medical writing, because the medical writing world is, I would say, that is more or less domiciled in the West, in US and UK. But most times when you come down here, you find out that most people don't even know what it is. I personally did not know anything about medical writing until I finished my residency. In fact, it was just 2 years ago. That was when I became active on LinkedIn, that I now started seeing it on people's headlines. And I was like, what is this? Initially, I thought it was maybe scientific writing, academic writing. That was when I started asking questions, and I found out that it wasn't. And most people still assume that medical writing is about maybe research, about helping people with their master's thesis or things of that nature. And that's not what it is. So, and I now found out that most people also didn't know the way I did not know. So that was when I started researching, and I started asking questions on LinkedIn. And that's why today I will have to mention LinkedIn a lot, even as we start. So I started asking questions and started reading, started researching. That was how I came to understand the field. So this is just the preamble that I just gave. So right now, we are starting the meeting now in the name of the Father and the Son and the Holy Ghost. So like I said, the topic is breaking into the medical writing industry from the global south. And you know, when you hear that word break, to break is to advance forcefully. So that means that it's possibly something that you have some level of resistance, that you may need to generate some energy to be able to enter into. Then part of that resistance in this part of the world is not even physical resistance, it's the resistance of ignorance, in that most people don't know what it is, and even some people assume they know what it is. And then even those that assume they know what it is don't actually know what it entails to be in medical writing. And that's why it appears that we are disadvantaged on this part of the world. So this is just, in the next 30 minutes or so, I'll just give you a rundown of what medical writing is. You won't be able to get everything about medical writing. I usually say that it's an octopus. It's hydra-headed with so many parts. But at least by the time we are done today, you will leave this meeting with a sound knowledge of what medical writing is all about. Because that was the challenge I met when I first found about it in 2023, and then 2024, that was when I went full blown. Not really, it wasn't planned. Like I said, I'm an accidental medical writer. It wasn't really that I planned that. What my intention was to expand my frontiers in public health. And we also know that medical communication is part of public health anyway, because public health deals with prevention of diseases, prolongation of life, and promotion of health. And that's what medical communication, at least some part of it, is all about. That was my intention. But then I picked up interest in medical writing on LinkedIn. I picked up interest passively, but I started researching. I had to reach out to some people that I met on LinkedIn, especially there was not one Nigerian that I saw. That was what I was like, how is she operating in a global industry right from Nigeria? I know this one of the reasons why people decide to leave the country, because they are in search of golden fleece. That was like, oh, someone can actually find this golden fleece without leaving the shores of this country. So that was when I started asking questions, and I was able to get some answers, and I had to do a whole lot of reading and a whole lot of things. I remember when I met her, when I sent a message to her watch and she responded, she just asked me to take a course and then referred me to read a book. And after doing that, that was when I understood the potential in medical writing. And as God will have it, that was also the time as we go along in this, I have to mention God a lot of times because I can't separate myself from him. So along the line, I got some levels of instructions from God on concerning my career, which I didn't really understand what it was as at that time, but I obeyed anyway. And that was when I transitioned from full-time clinical medicine to my intention was to transition into public health. And within 2 weeks of taking that decision, the first DM I got on LinkedIn was from a health website. I didn't even ask them. I didn't even know who they were. I just saw a DM and it's from Semi-Health. As we go along, I'll mention them. And I was like, they were like, I want you to be a medical reviewer. That was my first time of hearing that. I was like, medical reviewer, what does it mean? So I now linked it to the medical writing that I've been studying passively. So that was when I now started studying it a lot. Initially, I thought they were scammers. But finally, I found out that they weren't scammers. And that was how I started with them. And from there, I progressed. So as we go along, I will tell you how the progression, because someone sent a question and was asking, how did you move from there to here? So, and I asked the person to join the meeting. So I asked the person to join the meeting. Sorry, and sorry about your network. Maybe you should change position so that you understand me better. You hear me? So that was how I moved from Semi-Health. So I started reviewing articles from Semi-Health, and I was reading a lot of health articles in plain language, not what I was used to, like scientific review. And the more I reviewed, the more naturally I reviewed things. People that knew me before now know that I naturally review. Once you give me a document, I have an eye, I can easily spot errors. So that was what I was doing even as a resident doctor, naturally. So the more I reviewed, and I was now like, I can even do this thing these people are writing. I can even do it better than. So why not become a writer? And that was why when I took the decision to actually explore the field more. Okay, so this is a bit of an introduction. I will still continue. So for those who don't know me, this is my name. I'm Dr. Zuke. First of all, a medical doctor before I became other things. I'm also a consultant, OBGYN, although I'm no longer in full-time clinical practice, but I still practice part-time. Public health scientist, then a medical writer, reviewer, publisher, and coach. Okay, so talking about my journey, this was where I started. Like I mentioned, that I was just on my own and I received that DM. And that's the beauty of LinkedIn, because if you're on LinkedIn, you are just there for the world to see. That's if you are doing the writing anyway. Yeah. So that was how they reached out to me. This is a health website, and I started with them. So I now decided to expand my frontiers in medical writing. That was when I joined Clarity as an intern. Now, I want you to take note of my journey, because one thing about medical writing is that you have to learn. You have to be ready to learn. As at the time I joined Clarity as an intern, I was already a consultant. So imagine coming down from that level to decide that I want to do an internship. Because I just knew that despite my level of expertise in medicine, that this is a field that I needed to understand. And there's no way to understand something than to come down. If you don't come down, you'll be able to really understand. That was why I decided to take up this internship with Clarity. Clarity is in the UK. So I took up the internship with them remotely. And I was there for 30 weeks. I did writing internship for 16 weeks, for 14 weeks. Then after that, I started internship as an editor for another 16 weeks. So that's 30 weeks. It was an unpaid internship. Why I'm mentioning all these things so that you understand the steps. So I was just reviewing, writing articles. Altogether, I worked on 63 articles within that 30 weeks. But it helped me to understand the field very well. It helped me to there was nothing I didn't write on, there was nothing I didn't review. So I went from immunology to ONG to surgery to internal medicine, almost every genetics. So, and that's why now I can write on anything. I can speak on any topic. There's no topic now in medicine that you ask me to come and speak on that I won't be able to speak on. So this helped me to move. Because being someone that I've worked in ONG as a gynecologist for long, I've been in that field for long. I needed to expand to understand more, and that was why I did this. So it helped me to expand my scope. It helped me to understand how to write for the public. You know, writing for the public and writing for scientists, they are two different things. Then while I was still at Clarity, that was when I joined Deadline South Africa, and I'm still with them. Deadline South Africa is domiciled in the US, but their focus is on African diseases. I think I've written close to 30 articles for Deadline South Africa. Then the journey continued. It was long after Deadline South Africa that I noticed the level of ignorance of people around me about medical writing, and it became a problem to me. So I saw myself explaining and explaining, trying to get people to understand. Without actually, I didn't even know what I was doing, but naturally, when I know things, when I learn anything, I love bringing other people along. So I was just explaining back. I noticed they were not getting me. So, and at the same time, at that same point, I was having a discussion with an editor, not the person wasn't in Nigeria, and the person was complaining that most Nigerians tag themselves as medical writers without knowing anything about the field. That was how he put it. And I saw it as a personal abuse, even though he wasn't talking to me anymore. We were discussing when he mentioned that. So, and that was when I decided thinking of what if I start a training program. That was still less than a year in the field. I was like, will people even understand where I'm coming from? But then, because I subjected myself to a lot of learning, I was able to build expertise within a very short time. In fact, between that time and December 2024, I had worked on more than 100 articles within that very short period because I put in a whole lot of effort. So as I was thinking about that, as if you read, of course, for you to have registered, you must have gone through that form. I was also planning for another program in memorial of my father that died on September 20th. He was a teacher by excellence. Like, and I want to tell people that I'm a chip of the old block. I just behave like him. The way he loves teaching is the way I love teaching people. So I was planning something, but it was more or less a structural thing, an educational project anyway. But then along the line, we had a hitch, and I was like, oh, so does it mean that on September 20th, I won't do anything again? That was when I remembered my interest in medical writing. And that was how those two things just collided. And I was like, oh, it should be a very good thing to start this coaching program on September 20th. And that was how we started. And then between that and September 20th, I had to go ahead to register the ACE Medical Consulting and Communication Services. So it's actually registered with the Corporate Affairs Commission of Nigeria before we even took off. Then Later, early this year, I joined the WHO FIDES network, a network of healthcare influencers. So I just wanted to tell you how I moved from a pure clinician to where I am. So I didn't just jump. I had to go through all these steps, and that's why we're where we are today. I had to put up this very flyer because that was the very first flyer that we used for that very first coaching last year on September 20th last year. I remember when I shared this on LinkedIn, I was afraid because I was like, who will believe me, knowing that I'm a newbie? I was surprised that when we put up the form, within 72 hours, we had about, I think, 22 or so people that registered. And because I was afraid, I went and closed the form. I didn't want more people to register. And that was why that first meeting, I think of the 20 something, about 13 of them attended that coaching. But after then, I picked up courage, and on the 1st of October last year also, we had another free medical coaching, and it was after then that we now took off in November and now started the paid coaching. And so far we've done 6 cohorts so far. In addition to the one-on-one coaching, those ones are different from the cohort training. So I want us to look at this very well. This is the map of the world. Just look at it. Later we'll come back to it. This is Latin America. Are you raising your hand? I can see a raised hand. If there's a challenge, you can put it up on the chat. Okay. This is US, Canada. I think this is Greenland also. Nigeria and the other parts of Africa. This is Russia. I think this is Saudi Arabia. So, okay, no, this is Saudi Arabia. UK is somewhere here. Okay, so just take a look at it. Okay, Zubia, you're welcome from Pakistan. So we'll come back to it. Okay, now, what is medical writing? In fact, just early this morning, I received a DM from somebody who was, since she wanted a training on academic writing also, and I was wondering why she sent that DM to me. Because people usually assume that that's what it is, but that's not what it is. Now, medical writing involves the development and production of print or digital documents that deal specifically with medicine or healthcare. So whether print or digital, but it has to deal with medicine or healthcare. So we're not talking about scientific writing or projects, no. It has to deal with medicine or healthcare. Most times, most of us deal with digital documents. In fact, I've never worked on a print document anyway, but some people do. Now, this is the definition by American Medical Writers Association. And this is the foremost medical writers association all over the world, because that's where in the US, medical writing is a multi-billion-dollar industry. There are other definitions, and there is no standard definition, but at least this gives you an idea. But basically what it entails is that it involves clear communication of health and medical information. And this clear communication may be for patients, so maybe just health education articles, or professionals, policymakers, or public. Now, the tone you use depends on the audience, whether you're writing to patients or professionals or policymakers or public. I've had to write somehow to all these people. So if you check my portfolio, you'll find that I have different grades of article, but most of them are for patients anyway. So the tone and the language depends on who you are writing for. So you should always understand your audience, and you have to communicate in a very clear way. So this is what we regard as medical writing. When we look at the niches, you understand better. Okay, so what are the top niches in medical writing? I call it top because there are some other ones that I may not have captured. Like I mentioned when we were starting, that medical writing is hydra-headed. It's actually a very large field. Now we have the patient education or consumer health niche. I want you to pay attention to this slide. Some of the things I will say are not on this slide, so just listen to me. Now, when you, assuming you have abdominal pain, and just type it on Google, when you type, you see a whole lot of websites pop up. Now, those websites are patient education websites. And funny enough, before I joined the medical writing, I never thought about them. I will just type and get the information without even thinking about the website where those things came from. So have you ever asked yourself how those articles came about? All those articles you see on WebMD, on Mayo Clinic, on Healthline, all those things are written by medical writers for the public. Because we have all this scientific information in textbooks, in journals, but we need to communicate them to the public. And the issue now is that people have actually moved from the clinics to their phones. So that's why you need to meet them where they are. So most people, before they even come to the hospital, they must have Googled whatever that was their problem before coming to see you. So that's patient education. And this is the largest niche in medical writing. I also call it the lowest hanging fruit. Lowest hanging fruit means that that's the easiest one to enter into. Then we'll have the continuing medical education. You know, in the US, in the UK, as a healthcare professional, you must renew, before you renew your license, you must have CME points. You must, not like in Nigeria that will just pay for it. So, and it's a major field over there. So they even get people from all over the world to help them generate those CME articles. And in fact, they have CME companies in the US. And they also have a body that approves CME programs. So those CME companies, even before they get those programs approved, there's something they call a NIST assessment. It's like a grant proposal. So they usually require medical writers anywhere. So they can get a medical writer from anywhere to join them to develop that NIST assessment. So that's a major field also in medical writing. Then we have the regulatory writing. This is the one you have in pharma industry. We know that before ever a drug is released, it passes through phase 1, phase 2, phase 3 trials, then the post-marketing survey. Now, those trials are usually coming, as they're doing the trials, you have people that write the protocols, the clinical trial reports, and submit before they now finally get the approval. Those processes, those reports are written by medical writers. Then we'll have marketing and public relations. For those of us that work in the hospital, I believe you must have seen maybe marketers coming from school, maybe those that if some people come in to market their pharmaceutical drugs, or even some devices, maybe ultrasound machine. And usually they come in with pamphlets and some leaflets. Or maybe you go to their website, you see some write-ups on their website. Now those marketing publications, whether on the website or on print, are written by medical writers. Even the drug leaflets you find in drugs, all those leaflets that you have within drugs, those things are written by medical writers. So that's another field. Then we have medical journalism. When you go, for those of us in Nigeria, if you check Punch newspaper, Vanguard, all of them, they have health columns. And even Washington Post, New York Times. But one of the things that attracted me so much to medical writing was when I saw a Nigerian on LinkedIn, he just shared the post that their article just got accepted on New York Times. I was like, New York Times, their health article on New York Times, all the way from here to New York Times. That really got me interested. So that's medical journalism. Now, there are so many other aspects of medical writing that I can't even capture here. Let me give an example. Now, we are having a whole lot of chatbots coming up, health apps coming up, AI-powered apps coming up. Most times, what people see is that you just put in a query and the answers come up. But behind all those answers, you have people who develop those flowcharts. I know I've worked with a UK company to develop a flowchart once. Those things are flowcharts developed by medical writers behind the scenes. So they just feed them into the app. So when you ask a question, the app will not follow the flowchart depending on your question and your responses. So That's another part, and so many other parts by writing for grants, maybe for NGOs looking for grants, helping them to write the medical component of their grant proposal. These are other niches in medical writing. Okay. Now, a medical writer can be either a freelancer or a 9 to 5, we call them employees. Now, for those of us in the global south, most times we don't have the opportunity to be an employee. Employee means that you have a medical communications agency, so people go there in the morning, they work from 9 to 5, they write, they give them projects to write on, they work from 9 to 5 and leave. The most medical writers over here are freelancers. Being a freelancer means that you are not fully attached to any particular organization. So you can work on multiple organizations, etc. You can see when I showed my list, you can see that I run with multiple organizations, etc. So it has the good and the bad part of it. The good part of it is that you have the opportunity to, it's very flexible. So you are not bound by anybody's rule. So you can do as much as you can. But also the risky part of it is that the projects are not within your control. So it depends on how much you put in within a month or how much projects that comes to you, unlike the 9 to 5 that you have to be paid the salary. But then for most of us here, we don't even have medical communications agency. In fact, that was something that prompted me to go and register. You can see the name. That was why that name became that long, because I really wanted to add communications to it. I didn't just want to stop at medical consulting, because I did an online search and I didn't find anything like that in Nigeria. But then when you research what medical writers do outside the country, you see that you have a whole lot of them in the US. So it's in medical communications agencies that you can be an employee. Apart from that, you have to be a freelancer, which most people actually love more than being an employee. So what are the benefits of medical writing? That's the benefit of career progression and promotion. In fact, what I normally tell people that you're writing can enter rooms that you dare not. If they ask you to step into the room, you'll be so afraid to enter. But what you've written and enter that room, in fact, many months or many years ahead of you. So that's one good thing. And one good thing about the medical writing field, for those of us that have published with journals, you know how difficult most times it is to get an article out. I know I have an article that has been with a journal for, it's about 10 months now, that's still doing peer review on it. That's unlike, but within 10 months, in fact, within the past 1 year, I've written 42 articles, health articles, and 5 blog posts. So that should be 47 articles. So it's easier to let me use the word, turn out articles in the medical writing space than in the academic writing space. And although they don't have the same weight anyway, because academic writing, those ones are peer reviewed, so they are considered to be of a higher value. But then that's what it tells you. You're writing, I don't know where my articles are at this moment, because they're all over the world. And anything can come up from any one of them. You can get a call or an email based on what you've written. In fact, most of the public speaking projects I've done, most of them came through my writing. Maybe they saw my article somewhere and felt that, oh, because you wrote this, you'll be able to speak on this. And that's it. Then it gives you the opportunity for global visibility. There is no boundary. If you put up an article here in Nigeria, it can get anywhere. So anybody can see it within a very short period. If you put it up in Pakistan, we can see it immediately here in Nigeria. Then global impact. As your articles are moving, you're also making impact. Like I've written on so many women's health issues. I don't know where those articles are, but people are reading them and they're benefiting from them. So it's not just about the career progression or the visibility, but also the impact you are making globally. Unlike before that, I would just sit, I just manage patients one-on-one as they come in. Now I have the opportunity to manage patients in bulk. I see it that way. Like I recently wrote an article on cesarean section in plain language. And when that article was published, I was like, this is something that I used to counsel patients one-on-one as they come in. But now it's all over. So that's the global impact. It gives you the opportunity for additional source. That's if you already have a source of income or even multiple streams of income. You know, that's where the world is going into. And you shouldn't put all your eggs in one basket. Because as you are, especially if you're a freelancer, so you're working for multiple organizations, that's how your income comes. Those articles you see online, people are paid, most of them, people are paid to write those health articles you see online. Then, if you are in a country with weak currency like our own, then this fifth point, this will interest you more because that's an opportunity to earn in multiple currencies outside your own. Because, like I said, there is no barrier, there is no deal. Once what you are doing for and the person you are doing it for is not within your own country, then the person has to pay you in whatever currency of their own country. So that's the way it runs. Then it gives you the opportunity to work from home. We have some medical writers in the US that don't even bother to even look for work. Maybe some of them are just stay-at-home moms doing their work and running their multi-million naira business just from their house. Because that's medical writing, you can do it anywhere. Once you have your laptop and have internet source, you are good to go. That's it. So that's an opportunity. And we know that the future of work is remote. Within the next 2 years, we don't even know what will happen to work with the AI tsunami that is happening now. And employers are finding ways to manage their expenditures. So they are looking more and more, they are looking for people who can actually do hybrid or maybe do it from outside the office so that they don't have to spend the money. So even healthcare is moving, it's shifting. So this is where we're going to. So that's one of the opportunities of that you can get, one of the benefits you can get from medical writing. What are the global opportunities that you have in medical writing? Like I said, there's no boundary at all in the medical writing space. You can work for health websites anywhere in the world, anywhere in the world, right from the global south. Remember that our focus is on the global south. Then you can work for any CME provider, right from anywhere in the world. But later towards the end, we'll talk about that more. And you can work for any hospital or health organization, something like Mayo Clinic, Cleveland Clinic, all those that are hospitals that they have run their own websites. So, and any other health organization anywhere in the world. Pharma companies, I talked about regulatory writing, that's under pharma companies. Then medical device companies, wherever, whether endoscopy equipment or scan or ultrasound or any other medical. Once they always need people who have some background health knowledge to put up those articles, those leaflets, and those monographs for them. Then health-related NGOs, all these NGOs that deal with health issues, wherever they are in the world, you can actually work for them. Medical communications agencies, well, like I mentioned, most times some of these people, they need employees, those that come and go, that work with them. But sometimes they also need hybrid workers or even pure remote workers and even professional bodies. Medical writers can function as conference, can produce conference summaries. Let me assume that the Association of Nurses and Midwives, that are having an annual general meeting, oh, not an annual general meeting, a conference, scientific conference. A medical writer can be contracted to cover the whole conference and produce the conference report at the end of the day. So that's one of the niches that I didn't mention initially. Remember I told you that it's hydra-headed. So the question now, having mentioned all this, someone will be asking, is there any place for medical writers from the global south? There is. And that's why I narrowed this discussion to the global south. One is because you have growing demand for high quality evidence-based content, health content. There's a growing demand for that because people now search for things on their phone before going to the hospital. So we have to provide that evidence-based health content for them. And you have a whole lot of, how will I put it, a whole lot of wrong information going on TikTok, Facebook. You have a whole lot of self-acclaimed physicians, self-acclaimed nurses dishing out health information. So that's why there's a demand now for high quality evidence-based health content. In fact, the Who Fidesz network, that's what that network is all about. That's the core reason why that Fidesz network was set up, so that people can generate high quality evidence-based content. Now, remote work and freelancing are increasingly becoming the norm. Like I mentioned before, things are changing and the future of work is remote. So that hospital you may be looking at in the next 5 years, the hospital setup may change a whole lot. So that's why you need to develop digital skills so that you can move with the times. The internet removes national and continental barriers. So right from here, right from your country, you can do a whole lot right from your country because there's no barrier on the internet. Then unique perspectives and culturally relevant insights from the global south are highly needed. There are some diseases that you just find in the global south. I mean, the average American doesn't understand maternal mortality. It's so rare. They don't understand malaria the way we do. These are our own issues. Then when you go to the Mediterranean or Asian countries, there may be some issues with them that we Africans may not be able to understand. So those unique perspectives, they're still needed. There's no way an American can write on malaria as the way I will write on it. So you can't compare because I'm writing from lived experience. So that's why those unique perspectives are still needed. Then there's rising health awareness and digital expansion in Africa and beyond. More and more people are having smartphones, more and more people are using the internet. So things are changing. So that's why we still have a place for those of us here from the global south. So what are the basic requirements? What are the things you need to be a medical writer? This is one I love so much because there is no basic degree in medical writing. There's nothing like BSc in medical writing. So it's a level playing ground for everybody. Once you have that basic health science degree, in fact, you don't even need to have it. There are some medical writers that don't have any science degree. So, and they're still within the field and they're writing articles and doing well. So that's why I say it's desired, but not compulsory. So now you need to be tech savvy. That's the one that you have to be because you work with a whole lot of apps, a whole lot of softwares, and you just have to be used to manipulating some of these things for you to succeed as a medical writer. And but the good thing is that these are things you can learn. I've learned a whole lot since last year. There are so many things that I can do now that, like now I'm presenting from Canva. As last year I wasn't, the only thing I knew was PowerPoint. But now in medical writing, you have to know how to do something in so many different ways because you may not know the request that may come to you. Okay, let me just assume I just did an express conversation yesterday. That was my first time. I'm not used to Twitter in any way, although I have one account there that I hardly, just recently I started using it. Then when the invitation came and I saw that the conversation was on Twitter, I didn't even say that I wasn't used. I had to learn how to join a meeting and speak on Twitter. I just had to learn it. So that's what medical writing is all about. You have to be that flexible to be able to learn things easily. And you have to have the capacity to synthesize evidence. Because what we do in medical writing is to get scientific evidence and then simplify it for the particular audience, whether if you are writing it for physicians as CME or to patients as medical writing articles, or you are writing to regulators, you are synthesizing evidence. So you have to have this skill. Then you have to have a learner mindset. This is very important because new projects will come along your way and you need to learn. But it's a very interesting field to me. So that's why if you look at what I have down here, I say, what did I start with? The first thing I started with was interest. And that's what you need. Once you're interested in something, forget it. There's no way you won't learn that thing. So interest, a laptop, a phone. I'm just saying how I started in medical writing. An internet connection, you must have an internet connection because we work online every time. You need that basic health knowledge. That was what I started with. And the willingness to learn. You have to be willing to learn. I've taken so many courses. I've read so many books. I've watched so many podcasts and videos, all in a bid to learn. So you have to move with the times. So now, what are our challenges here, those of us from the global south? Like I mentioned that this field is more or less domiciled in the US and UK. So in the US and UK, you don't need to ask anybody what is medical writing. They know what it is, unlike you. So one is visibility and recognition. Now, some of us are not even active on LinkedIn. So we're not even visible. And no matter how much you know, unless you put it out there, nobody will know how much you know. So you have to, for me to be saying this, I was very social media naive until 2023. In fact, my picture wasn't anywhere on social media until 2023 because I was like, no, why should I? But then, as I progressed in my career, I just knew that you can't continue to do this. If you are aiming for the top, then you have to be seen. That's just it. And you won't wait for somebody to do it for you. You have to do it yourself. And that was how I came up on LinkedIn. So you have to be visible, and that's why you need a LinkedIn account. So that's one of the challenges of visibility. Then sometimes, even after being visible, you still have the challenge of recognition. They won't, even when you are visible, they may not see you as being as serious or knowledgeable as maybe somebody from the West. So that's also why you should prove yourself. Then we have the problem of language barriers. Some of us are from non-native English-speaking areas. Well, and most times you write in English. But what I usually tell medical writers is that it's not an excuse. You have to learn how to write in English. If you really want to write in English, unless maybe you want to do your own medical writing in French or in your own native language. If it has to be English, you have to, and you need to prove it to people from the West that you can do this. And the only way they can see do it is maybe when they see your post on LinkedIn or when they see your portfolio and see the articles you've written in very good grammar. You have to prove it to them. Then limited internet and tech infrastructure. Some places in the global south don't even have internet connection, and that's the challenge. So just recently that 5G came down to us. I know for how many years it was over there in the US. So most times we find it difficult to do some things that we should do. Then we have pay inequality. Now, let me assume that you have a 1,500 words health article. A writer in US may be paid $400 or $500 for that. But somebody in Nigeria may be paid $50 for that same article. Or somebody in India. In fact, somebody was telling me the other day that Indians, that sometimes they may take $10 per net to gold and $15. That those people that they don't have problems, that their life is very simple. For that same article, someone in US, they will pay the person $400 or something of that nature. So that's one of the challenges. They feel that you shouldn't even have as much as those people. So that's why you should also prove yourself. Now we have lack of local role models and communities. I remember, like I said, when I started, most of the medical writers I saw were Westerners. And until I found one Nigerian that when I looked through her profile, I saw that she had advanced in the field, and I had to reach out to her. But most times, most people don't even, they may have it on their LinkedIn profile, but when you look at the profile, you won't find anything to substantiate the medical writing. Then, okay, lack of local communities. But that was why I had to open that WhatsApp group. It wasn't my intention. I just wanted to do the coaching and go away. But then I now found out that if you don't gather people together, they'll just disperse, and you don't have any community like that you can actually discuss medical writing issues. And that's why we have that WhatsApp group, and also have the premium group where people have the opportunity to share their thoughts and share resources. Then we'll have this unconscious bias and trust issues from clients up there. Unconscious bias is when you just feel somehow towards somebody without, sometimes you may not even know why. So the average white person may not see some of us who are blacks, or those of us from Asia, or they may not take us as that serious. So they already have some bias towards us anyway, and that may affect their relationship with us. Then trust issues. For those of us, I don't want to mention the country, but I know we know the country. There are some countries that once you bring out the passports anywhere, you're already in trouble once they cite that color of passport. So, and the same thing happens even in medical writing. So we have trust issues. They'll be like, these people, can I trust them? Will they be able to put up a very good article? Then limited exposure to industry standards. In the US, you have the American Medical Writing Association. They hold conferences every year. The same thing with Europe. You have European Medical Writers Association, they hold conferences. So they know the industry standards. But here, we don't have any association, no standard. So we're just trying to learn from them. And that's why I usually encourage people on LinkedIn, try and follow those people, follow their pages so that you understand what they're doing. Don't just play local, because this is a global field. Then you have fewer training opportunities. And that was also why I considered creating this training program, this course, because when I came up, the only course I did wasn't by a Nigerian, it wasn't even by an African. So I checked, I didn't see any course being organized by an African. And even the ones I saw, I remember seeing one of $1,900 and something in the US, and that one of, I think, 100 and something pounds in the UK. So, one, in terms of affordability, then in terms of the content, because they're saying it from their own perspective, I saw that there wasn't anything that can write here in Nigeria, and that was why I had to. In fact, what actually became the course was all those things I was reading, all those videos I was watching. Because when I was watching those things, I was writing. So it was that my book that I used to jot down things that finally became the course. Okay. So how do we break this glass ceiling? I've already mentioned some of them in that slide, because this is a ceiling that we have to break, because this is a global field and we need to play our own part. One is that you have to embrace the edge. What do I mean by embracing the edge? Within the center is where you have the crowd. At the periphery, you don't have crowd there, because everybody is at the center struggling for. So if you look at even within the healthcare community, most of us are within the center struggling for things to do within the hospital. So for you to even learn how to come out from there, you're already at the edge a bit. But even within that edge, you still need to understand what you are doing. First of all, you need to understand why you serve. For those of us that have taken our courses, this was something when we deal with module 2, because the course is in 3 modules. We always come to that extent that we'll ask ourselves, why are we here? Why do you serve? You have to give it an answer. To understand, why do you want to do medical writing? Why are you on LinkedIn? Why are you on Facebook? You need to answer that question. So understand why you serve. Then understand who you serve. Okay, within the medical writing field, I've mentioned that there are so many niches in medical writing. Do you have a particular flair? Or do you have a flair for a particular niche? Okay, you can see that I operate more in the patient education niche, maybe because I was a full-time clinician before. So naturally, I tilted towards it. But that doesn't mean that I won't be able to do the other ones. I have a natural flair for that. So you have to find out where you have that natural flair. Then you have to determine how you serve them. How you serve them means determine to the extent to which you show forth excellence. Now there are so many medical rights. I review a lot of articles. I've reviewed more than 130 articles or so. And when you move from one article to another, you see the differences between writers. There are some people that go out of their way to do the writing. There are some people that it doesn't even bother them. They'll just write it anyhow and submit. So you have to, for you to embrace the edge, you have to determine to what extent you want to show professionalism in what you are doing. Then what makes you different? That's what we call your unique value proposition. Everybody's a medical writer. Everybody maybe read pharmacy, studied medicine, but you have to show that you are different. Maybe your difference may be that you are that person that you always submit your work on time, you always meet the deadline, or your unique value proposition may be that you are so meticulous that when you finish a project, it's difficult to point out an error in that project. So find out what makes you different. That's what removes you from the crowd, and you'll find that the way people relate with you will now differ because you have so many medical writers. And you can find when I entered the field, what I was seeing on LinkedIn, I was just seeing people with medical writing on their headline, and what every other person was looking for, trying to, hey, how can I get this foreign gig? How can I get this foreign? I joined them all anyway. That was how I got this line health Africa, I got clarity and all those ones. And I still do that. I'm still looking for, because foreign currency, once you get it, it helps a whole lot. But then beyond that, I started looking beyond what every other person was doing. And that was why I went ahead to register a medical communication agency. I didn't say nobody did that before I did it. I just went beyond that because I needed to embrace the edge. We started a health library. I don't know how many people of all the people I met on LinkedIn that have a health library. I had to start it just, and what I was doing was to embrace the edge, to come out from that crowd. So you need to know how to pull yourself out from the crowd, and that's when people will start seeing you differently. So do we have local opportunities? Now this slide is very important. Beyond looking for all those foreign gigs, we have a whole lot of medical writing is the green area. So it's a virgin land in this part of the world, in the low resource sectors. So what you ask yourself, we have CME programs for health workers in the US. Do you have it in your country? And if you don't have CME programs, can you help to develop one and monetize it? People pay to access those CME programs in the US. What can't it be done in Nigeria? Can't it be done in Pakistan or India? Can you allow yourself to be used to do that? So these are local untapped opportunities. What of health websites? Most of the health websites that are outside the country have WebMD, you have Healthline. And that was what I looked at. I was like, this thing that these people are doing, I can do it too. And that was how we started our health library. And the health library is growing. So can you create a health website? Is there anything wrong with doing that? What of hospital websites? We have so many hospitals. We don't have time. I would have said, let's just check one hospital in Nigeria. You see that the only thing you see there is they will tell you about their services, and maybe their staff. They'll mention their doctors, and they don't have health websites. But then you have Mayo Clinic, a very big hospital, Cleveland Clinic, a very big hospital, but they run health websites and they're making a whole lot of money from these health websites. So maybe you can decide to visit hospitals and discuss with them that you can actually revamp their health website and create a health library for them. That's a local opportunity. What of producing health education in your local languages? Yes, we've been writing in English, but what of considering writing it in your own language? That's another opportunity. What of NGOs and those people that do health campaigns within your locality? You can help them to develop the script that they use for those health campaigns, to develop their skill, even the leaflets that they distribute. What are the government health initiatives within your country? Yesterday, I was trying to read through the Mental Health Act of Nigeria, and it was just so bulky that I couldn't even understand some of those things. And I was like, someone can actually summarize this mental health act maybe in 4 pages. So you can decide to do that and write a proposal to the government that you want to be summarizing their policy briefs and all those. So that's a local opportunity. What of having a community focused health newsletter? We have magazines and we have fashion magazines. I don't know whether we have anything called health magazine in Nigeria. I don't know. What of in your country, in India, in Pakistan? Do you have such? That's an opportunity. What of developing social media content? You can see what some people are doing. Let me take an example in Nigeria, Proctor Doctor, you can see what he's doing with social media. That doctor doesn't need to enter any hospital to work. Because what is making on social media, most doctors that will not even make it in their lifetime. When we talk of the monetary aspect of it, then the impact. In fact, as a doctor, I listened to him. The other day, I was listening to one of his videos on colorectal cancer, and it made so much sense on prevention of colorectal cancer. So these are local opportunities that you can look at, even in your own country, wherever you are. So how do you begin your journey? One is you have to build a formidable LinkedIn presence. You have to be on LinkedIn. You just have to be on LinkedIn, and it's not enough to have your profile. LinkedIn is not a CV. Some people will just set up their profile and they disappear. No. So you set up your profile. That's very important too. We call it profile optimization. But at the same time, you have to be present. You have to create posts. Let people see you. Let people. That's what we call thought leadership. Build thought leadership, and that's why you have to be careful about the kind of posts you create. You have to. I can't unbundle this and this. You can see the time now. I can't unbundle this. So if you want to really learn more about this, you subscribe for the course. But you have to come out the way you want people to see you on LinkedIn. And that's why sometimes when you look at some of our posts, they they are not so casual, because we're intentional. Like me, I'm very intentional about what I write because I'm thinking of a particular audience. And that's what you have to learn about LinkedIn. If you just want to write for the average LinkedIn audience that will be liking and commenting and loving you without making an impact, then you may need to water down what you write. But if you are thinking of policymakers, of decision makers, then you have to decide the kind of post you create. So I won't be able to onboard you, but just know that LinkedIn is an opportunity for you to tell people who you are. Nobody will do that for you. It's an opportunity for you to tell them who you are and what you know. And it's also a way to learn, because on LinkedIn you are writing for people to see. So you are learning it. In fact, that was where I learned how to write. Partly anyway, I was writing before then. But it will help you to write in a way that people can scrutinize and you are comfortable. Then network actively. Network with people on LinkedIn, network with people outside LinkedIn, find people who have the same interests and learn from them. Then informally through posts, videos, podcasts, articles. Like I said last year, the kind of learning I did last year, I was so aggressive about learning about medical writing. I was reading posts, watching videos, podcasts, articles, seek mentorship. One thing that I've noticed that some people will just come to your DM on LinkedIn and say, I love what you are doing about medical rights and I want you to be my mentor. And they will after writing that, they will disappear. For the next 3 months or so, you won't even find them around you. That's not what mentorship is all about. And no, mentorship is mentee driven. You are the one looking for something. So you have to come around that person, find out what they're doing, go through their posts, read their posts, ask questions. That's what mentorship is all about. Like I mentioned, when I came on LinkedIn last year and I observed this medical writer, Nigerian medical writer, the way I was all over, in fact, there's no way she make a post and I won't make a comment. I usually read all her posts. I'll go to her DM, ask her questions about the post that she made, that she just created, and ask her questions about other things. That's what mentorship is all about. You have to be aggressive to learn. Enroll in internships. For those of us that joined us late, I mentioned how I did a 30-week unpaid internship. I have to stress that. The fact that it wasn't paid for didn't bother me that time because I was looking for experience and I wanted to build my portfolio. Or volunteer opportunities. What I normally tell people, you don't volunteer for a very long time, but at some point in your career, you may need to do that if you really want to grow. grow. You may need to do that at least to gain the experience that you need. Take courses and pursue certifications. Taking a course shortens your learning curve. There is no way that on your own you try to gather those unless you are very aggressive or like I told you what I did last year. Then you have to show a whole lot of aggression to be able to pull up those information from all over. Now, what a course does is that it pulls those information for you and puts it in one place. So it's a form of guidance, so it helps to shorten your learning curves. Then pursue certifications. If you have a course that has a certificate, it's good because sometimes people look at some of these things, although certification is not the most important thing. The most important thing is the expertise. Anyway, so try and learn and try and develop expertise. Grow with consistency. There are some people that they will just come up, they will, I think they call it shooting star, that star that will just move like that. You see them shoot like that on LinkedIn, then they will disappear. That's not how to grow because most times before people come to the point of maybe calling on you to come and do something for them, they must have worked you for a long time. So when you just shoot like that and you disappear, they will look for another person. So grow with consistency. Continue to learn with consistency. Don't learn today and disappear for the next 1 month. You are not doing anything new. Learn, continue to learn, continue to practice. Develop your soft skills. This is something I've noticed that is a problem. Is a whole lot of problem in this. I don't want to call any particular generation, maybe Gen Z or not. There is a problem. Some people don't know how to communicate. Sometimes you just see somebody just go off. Maybe you are doing something with someone and the person will just disappear like that with no communication. And I've noticed that a whole lot. So you have to develop your soft skills because medical writing deals with it. Most times the people you are working with, you are not seeing them. So you have to learn how to communicate across the internet and use the proper language to communicate. Be a person of integrity. And this is a problem that most times the Westerners, when they look at some of us, especially some of us from some particular countries, they find it difficult to trust you because they don't know the next thing you throw up. So you have to show that integrity, even in writing. I've seen people show sometimes you see people showing a lot of lack of integrity even in their writing. That if you are not careful as a reviewer, they will implicate you. I've seen people pull up references that don't even exist, or they will just put up numbers without even cross-checking the references, thinking that you as a reviewer that you won't see it. Or they will just put up hyperlink to sources that are not related to the article. So that shows lack of integrity. So be a person of integrity. And also, if you are asked to write an article, maybe something like an article, and you go to AI and just download the article like that and submit as your own work, that also shows lack of integrity. Cultivate a strong learning mindset. I think I've said this over and over again. You have to be a voracious learner in medical writing. Then you need to practice, practice, and practice. You just have to practice. I usually tell people during a course that the only way to learn how to write is to write. So, like now, you are looking at me. You can't learn how to write just by looking at me. No, you have to sit down and write. I remember my first article when I joined Clarity. It was on salmonella in pregnancy. And it was so difficult because that was my first time of writing a patient education article. To write that article in plain language was so difficult for me. I remember then I would write and I would just get up and be pacing up and down because I couldn't. But by the time I wrote the next one, it became easy. So ultimately, when you do all these things, you have to, after you must have done all this, you have to build a portfolio. Now, in the medical writing field, your portfolio is more important than your CV. Your portfolio is a collection of your articles. If any one of you checked my my profile, you see my portfolio there. So if you've not checked it, you can go and check it so you understand what a portfolio is. It's a collection of the articles you've worked on, or maybe the articles you intend to work on. Let me assume that it's a collection of articles you worked on. Then whether you worked on it for a brand or maybe on your own, you just created the article on your own as a sample. So then you have to sit down and develop those articles. But that's why I'll still show you our YouTube channel, because I have a video there on how to build a portfolio. Most times when people are looking for clients on LinkedIn, what they will ask you to submit is your portfolio, not your CV. Your CV shows what you've been trained to do, but your portfolio shows what you can do. There are two different things. So you have to build a portfolio, open a LinkedIn newsletter, you can open an account on Medium, and write. You don't need to have a client to build a portfolio. I won't be able to say much on this because of our time. So go and check that video. You can also enroll for the course to learn more. Now, remember when we started, I said that we should look at this. Now we are back. We are back to this again. So now, looking at this is where I am. This is where I am. This is Nigeria. And you can see these other countries. Now, this map is from our website. I just picked it from the Google Analytics for our website. And I just wanted to use it to show you what medical writing can do for you. So right from this tiny spot, somewhere in this Nigeria, somewhere in Nigeria, from here, my influence has gone all over the world. So you can appreciate now, just whatever we are doing it from here. I know we have writers, some of them are outside the country, but they'll still send it to me. Then we will review, we'll publish. So from this spot, we've moved all over. In fact, the places that you see that are blank, those places are non-English speaking areas. That's why we've not invaded that place. Even in Africa, you see some countries, we also have some French speaking countries in Africa. So this will tell you the impacts of medical writing without leaving the shores of this country. See the extent we've gone, and we're just starting. We're just starting. So this shows you when I talk about global impact, global visibility. That's what medical writing is all about. So sometimes you even wonder, do people still need to migrate? In Nigeria, we call it Japan. People still need that if you can actually make an impact from where you are. So always remember this as you think about medical writing. So we've actually come to the end. My pattern was to use start. You have to start. Until you take that first step. Like if you check, I think I scheduled a post for this evening. I've not even looked at it. That most of these things I did them with fear. Yes, not the first time I sent out the flyer for the first coaching program, I was afraid. The first time I wrote my first article, I was afraid. So do it, start, do it afraid. That's if you don't start, you will know where you are. Then learn relentlessly. This is about the fourth time that I've said this. Be a voracious learner. Learn relentlessly. Bond with your creator. I have to mention this. Most of the things I've done, if you ask me to fully explain how I did them, I may not be able to give you 100% explanation. Because some of them just came maybe as I was praying or worshiping. I just had an idea. Do this thing this way. Do it this way. And just go and try it. And you see it working. I remember it was during our very first coaching, that 20th of September last year, that God specifically asked me, say, when doing that coaching, ask for volunteer writers. And I was like, how can I even ask for writers? I'm just 5 months in medical writing. And I made that call. Surprisingly, some people say, okay, we'll join you. And that was how we started the health library. Without a website. We didn't even have a website. We just started it on LinkedIn. We were writing articles on LinkedIn. Then before the website now came on board early this year. So bond with your creator. You cannot be creative. You cannot be a creator without the original creator. God is the original creator. So that's where creativity comes. By the time you do all this, you see that your unique voice from the global south will shine in the world of medical writing. Now I open my DM and I see a whole lot of mails from all over. In fact, some of them they will send it to our business page because they don't even know who is behind it. They just by seeing the Ace Medical Consulting, they won't know whoever that is behind. They will just send it. It's when you now respond, they will say, okay, is it this Nigerian that is behind this? So yes, there is no boundary. So you can do anything, you can be anywhere. And if you look at that group, you see that we have so many nationalities, so many nationalities. So that's one thing about medical writing. So this is just an introduction to our courses for those who may not know our course packages. We have about 5 different course packages. So we want to meet people where they are. So that you won't say, okay, because I don't have time because of this or because I don't have the money for this. So I call this the 14-day medical writing challenge. I call it a flagship course. Because this is the one that will run through on LinkedIn. Apart from writing, we also expose you to LinkedIn as well. So that's one of the packages. And the next cohort is coming up in November. The early bird registration ends October 5. That's the November medical writing challenge. Then we'll have the one-on-one medical writing coaching. This one is for individuals that don't want the stress of running through LinkedIn and doing all the work that we'll do during the 14-day challenge. So this is also an option. Then the small group medical writing coaching. Maybe if you have a small group of people that you just want to be trained with them, maybe a group of not exceeding 5. So this one is an option. Then we'll have the pre-recorded course. It's the same course that is pre-recorded, although with some, because normally during the course we do live demonstrations. So you don't have those live demonstrations in this, but this you still have all the modules in the course on this, and this is a cheaper option, and it's also good for those who don't have the time to do a live course. But there are some subtle differences between it and the live course. Then this is a LinkedIn navigation course. If you just want to understand LinkedIn as a professional, very simple and straightforward course. So this medical writing book is just a manual, very simple book, and I just wrote this from the experiences I gathered from reviewing articles. So it's available on Stella. So, and it's very practical because by the time you go through it, you understand all the mistakes you shouldn't make as the writer. So this is about us, the Ace Medical Consulting. So we do a whole lot of things: training, writing, review, medical editing, consulting services. We're just coming up anyway. We're just 1 year old. So health workforce training. So these are YouTube channel, and I would advise you to check up that YouTube channel because some of the things I say, some of them are there in bits. So you have some videos that will help your writing journey, and you can find our websites here and also take it. So thank you so much for listening. These are our contacts. You can contact us through any one of these, Gmail, my number, and all those. So if you have any questions, you can put it on the chat. We'll also give you the opportunity to ask. Then some people sent their questions ahead of time. I hope they are here because I noticed that most people that registered didn't show up. So what I will do is, I need to stop sharing so that we can see me. What I will do is that we'll have to answer those questions, the ones that they sent before now. But if you have anyone, you can put it on the chat. If you have any question, you can put it on the chat. I wanted to, just that our time is fast spent, I wanted to, okay, maybe we'll just take a few minutes to look at that. So if you have questions, you can put it on the chat. Sorry about the echoes because I'm trying to show something.
I also know that some people need some guidance. And in fact, all of us, we need that. Your attempt to strengthen your learning goal. And that was how the idea of creating this course came about. So then, this is the 14-day medical writing challenge. Welcome once again in the graduation. So, I usually ask the participants to take note of this slide, that the outcome of this challenge depends on you. It depends on you. As for me, anytime we are doing this, I devote myself wholeheartedly to it. I give you all the information. But then what you do determines the outcome of the challenge. So I did this, I called it the basis in natural physiology. We've lost them completely. So this is one question you have to answer. Anytime you have an answer to it, then we're discussing for the trade contract. Well, most of them understand. Also sent to them. Okay, now looking at this particular, I can see OCNIT, pharmacist. Then you can now add, as well as you added interval appendectomy. You know that interval appendectomy is when you have appendiceal mass, appendix mass. Or I think then you also have access. See complications following appendicectomy. Or put it in their own language. You say complications after appendix surgery. This is the natural. The limitation is medical and it's for people. They gather the knowledge and they want to implement. Please, that's what that's going to implement. Good. See you. Good morning.
Okay, so I just sorry about the echo. Just showed us a bit of our coaching program, then the participant testimonials. That was all that I fast forwarded it because of our time. So now some people sent in their questions ahead of time. So I hope they're still here for me to answer. Because that's what I want to do now. The questions sent ahead of time. So the first question is, what are the various niches in medical writing? I think we've already handled that. We talked about patient education, medical, CME, the pharma industry, regulatory writing, and so forth and so on. So then the second person said, I just copied these questions the way I saw them. Say, what are the steps for growth for a nursing student starting from the grassroots seeking an international stage? Then I've outlined the steps that you need. The learning, you have to learn, you have to be on LinkedIn, you have to find other medical writers and bond with them and ask questions, seek mentorship, take courses, and and listen to videos, to podcasts, practice. These are the steps that you need to take. Then this person said, how can I be part of the learning process? So I don't really understand this question. So if the person is talking about the courses, I think I've already mentioned that, what you need to do. Then this one, how to start medical research and become a medical writer. How to start medical research and become a medical writer is to learn. Like I've said, learn. If you can enroll for an internship, very good. It will help you if you find a volunteer opportunity. If you can find courses, you can go on YouTube and learn. There are so many videos on YouTube. In fact, last day there was a time that I was watching every day. I used to watch at least one video every day. That's how to learn how to research and become a better writer. Then this person said jobs, credentials for a beginner. You don't have the only credential you need is your basic health knowledge, which I said is not a must. You need your laptop, you have to have the interest, you have to have internet connection, and the ability to synthesize information from the literature. You need to know how to use Google Scholar, you have to know how to search PubMed. Then, how best to write your manuscript from your dissertation. Now, this person is talking about academic writing. That's not what medical writing is all about. Then this person said, how do someone become good at writing articles in the medical writing field? What are the requirements? These are all the things I've mentioned. Just get yourself acquainted, get close to people who knows some of these things and learn from them. Learn from people's posts. I read people's posts a lot. You know, most times when people go on through LinkedIn, they're just looking for where to like and comment. Sometimes not sometimes, most times I settle down to read posts. But one day there was something someone mentioned and I highlighted that in my comments. And the person was like, oh, you read this to this extent. So read to learn. Then research their profiles and know the things they're doing. Download. I have a lot of downloads. Download anything that is downloadable about medical writing anywhere and read. Then practice how to write. You have to practice. You have to sit down. Maybe generate a topic on your own and sit down to write. So the requirements, I've already mentioned the requirements. What's the edge it gives to a person? What's the edge? I can't understand. Well, the edge may be the benefits that will mention: global relevance, global impact, global visibility. And like I mentioned, your writing can enter rooms you don't even dare enter. So most times your writing goes ahead of you. And of course, you have the opportunity to make extra income from there. Then how do I learn to simplify complex information without losing accuracy? Okay, let me take an example for myself. I've been a clinician and most times we explain things to patients in their own language. So if you do that often and on, it becomes easy for you to even write it. So it's something that you have, most times I'll have to look at a particular, let me say, sentence over and over again, write and rewrite over and over again. Thank God for ChatGPT now. In fact, sometimes you can copy some of those sentences or paragraphs and ask the ChatGPT, please help me to break this thing down into plain language. It helps a lot. So that's one way to simplify, but make sure that after it simplifies it for you, make sure you read it to be sure that it didn't lose accuracy, just like you said. Then what strategies helped you land your first paid medical writing gig? Like I mentioned, having a portfolio is very important. And when I found out that, when I came into medical writing, I found that I needed one. What I did was I had my LinkedIn newsletter before then, but I used to write inspirational articles. In fact, it's still an inspirational newsletter if you look at some of my articles. But during that time that I was looking for this, what I did was I started writing public health articles on that LinkedIn newsletter. So, and that was what I used that as a portfolio. So when I have a client, maybe I remember the client health affair, that was they requested for my writing samples. So what I did was to send my LinkedIn newsletter articles. So, but now I've gone back to writing my inspirational, because now I now have a portfolio, so I don't need to do that. So my LinkedIn newsletter, I've turned it to writing inspirational articles. But once in a while, I write on public health anyway. Yeah, so that's how generate a portfolio. You can open a Medium account, and it's free. Some of these things are free. You can even use your normal Google Docs, like what I'm looking at. Maybe you say, I'm writing on hypertension in pregnancy today. On your own, write it and leave it there. When a client comes and requests, send it as your own sample. That's how it's done. Then, and of course, you have to understand LinkedIn. Before I even understood LinkedIn, I had to take a LinkedIn challenge course with Homa Wong. I had to take that challenge before I was able to understand how to operate on LinkedIn. Then how do I learn to simplify? Okay, that's it. Is paraphrasing allowed in medical writing? I don't understand what this means, but of course, we paraphrase. For you to reduce plagiarism score, you have to paraphrase. So why not? So to teach us how to write articles very fast, we learn how to write very fast by writing. It's just like driving. The more you drive, the faster you get. In fact, sometimes you now start driving unconsciously because it has become part of you. Then someone say, how did you start this initiative? I know the person that asked this, and she's done here. I asked her to join the meeting for me to answer this question. That's the story I told us. That I started with my deciding to step out from full-time clinical practice. Then, maybe like I said, it was an incidental medical writing just came up. Your Semic Health reached out to me, and I now said, okay, this thing I've been seeing on LinkedIn, let me even explore it. And one thing led to the other, and I got to where I am. So it wasn't a straightforward journey, but it was a journey of listening, taking instructions, and learning along the way. Okay, so that's about all the questions I got before now. So let me check what we have on the chat. Okay, someone said, Chiamaka, I hope she's still here. Someone was complaining about network.
Yes, ma, I'm here. Good evening, ma.
Okay. My question is, what's the difference between positioning as a medical writer versus a health writer? Now, there was a day we had this discussion. I won't call it an argument. It was a discussion that I even had to tag some medical writers outside the country to help us answer. Because for me, the standard term is medical writing. That's what they call it in the US, and that's where all these things generated from. But then when you come down over here, you see some people, maybe because they are not doctors, they feel that may be more comfortable writing health, just putting it as health writing. But the standard term is medical writing. That's why you have American Medical Writers Association, European Medical Writers Association. Whether you're a doctor or not, it doesn't matter. That's the standard term. But anyway, that day that we had this discussion, some people also felt that health writing is less technical. If you want to position yourself as somebody that works on maybe just patient education articles, patient education articles are less technical than writing CME or regulatory documents. So that some people prefer to use that to position themselves as this is what I do. I don't want to go into those technical parts of medical writing. So that's what some people think anyway. But for me, the standard term is medical writing. And if you want to position yourself, you position yourself in a way that globally everybody will understand what your own line of thought. Then Abigail, how do I learn to simplify? Okay, that's what strategies help you land. I've mentioned the strategies. I position myself on LinkedIn, like I said. I built a portfolio without having any clients. So you don't wait for a client to build a portfolio. That's it. Then someone said, do we need to pay for these internships? Well, I didn't pay for Clarity internship, and they didn't pay me either. So it was a mutual, it was mutual. I didn't pay, they didn't pay. So you just do your work and submit your articles. And then once in a while, we used to have weekly tutorials, weekly webinars like this, something like this. So where sometimes they do live article review. So that's it. Although the other day I was going through LinkedIn and I saw one internship that you have to pay for. So I don't really know about that. So what we do, we don't, like I usually tell people that we don't, what we do at the ACE, we don't run an internship, not an internship. It's just for volunteer writers. So it's assumed that you already have some level of knowledge. Because internship demands having a faculty to train those people, which we don't really have the capacity for that at the moment. Okay, I'm going to say I couldn't participate due to, but thanks for the, okay. Thank you. I hope your toddler is better. Then, Chiamaka, are there particular sites you recommend me to use to source for information? I normally use PubMed or Google Scholar. In fact, what I do is that if I'm searching for anything, maybe I want articles on diabetes in pregnancy, I just write treatment of diabetes in pregnancy, I put PubMed at the end. It's my own simple way of doing that. So once I do that, the search will just filter out peer-reviewed articles for me. But if you don't do that, if you put diabetes in pregnancy, what you'll be saying is Cleveland Clinic, Mayo Clinic, WebMD, and all those ones. And they're not, you can hyperlink those ones, but that is not good to use them as references. Because you know one thing about writing is that the further away you move from the original source of information, the more dilute the message is. So it's better to go to the peer-reviewed articles, get the original information from them. You can now hyperlink some of these help websites. So what I do, I go to Google Scholar straight away instead of just using the normal Google, so that you can get peer-reviewed articles. Okay, I think that's all. I don't know whether we have any, maybe someone wants to speak. Someone is showing us a camera. I hope she's aware. Dr. Nana, your camera is on. So do you have anyone, maybe you want to voice out your question? I'm done with the questions here. Any other question? Or we should call it a day? I think we've done justice. Okay, so if you are still with me up to this point, thumbs up. Okay, thank you, Abigail. Thumbs up, thumbs up. Okay, thank you. So this one is for this. So now if you want us to close, thumbs up. Okay, I think in the absence of any other thing, if you want us to close, thumbs up. If you want us to close at this moment, just give me thumbs up so that I will end the meeting. Okay, so congratulations to all of you for joining. You know, usually many are called, but few are
Thanks
chosen.
so
That
much.
happens in most times. People will just register, and not everybody will turn up at the end of the day. So congratulations that you registered and you still turned up. So that's a plus for you. So see you at the top. And thank you, my chief. My big chief is here, Dr. Maureen Omemo. Thank you for joining and staying till the end. Thank you, Chiamaka,
Big
Ibeji,
effort.
Chiamaka, Good David,
Okay,
Arone,
thank you.
Abigail, Dr. Fani, Isaac, Nena, and all of you. So I can't see them again. Okay, so see you at the top. And if you're interested in medical writing, try as much as possible to put in the effort. It's a free one. So see you. Bye.
Please subscribe.